Hello, I'm Phil.
Hi, I'm Esther.
So today we're going to do a video about a specific piece of technology we have in our clinic. So we love looking for things and finding sort of world-class therapies and treatments for fixing the problems that our patients have. And today we're going to talk about our super cool MLS low-level laser. So Esther, this laser, I know you use it a lot because sometimes I'm looking for it and it's generally in your room.
Yep.
Because you love using it because
do.
you love the results it gives for our patients.
Yeah.
What are the kind of problems that patients and people that are watching this that they have that you could help them with using this piece of equipment?
Yep. At the moment I'm treating a few patients that has quite a few acute conditions. So the main one being plantar plate tears or partial tears in the plantar fascia tendon. So any type of tear related conditions I've been using the laser for.
Well, tears are a sudden injury, aren't they?
They
you
are,
don't have
yeah.
it and then something happens and there's a tear and it's kind of this sudden onset of pain.
Yeah.
And when you said acute, that term, for people that don't understand what that means, it means that it's short term and sudden in recent onset of pain. So with acute pain, what is it that you find, what kind of difference has it made being able to use this laser for people with acute sudden injuries like this?
Yep. Well, the fact that the laser is basically painless, so but it's actually working at a more micro level as well to heal up those tendons and those ligaments. So it works at a more micro level, repairing those cells in the tissues. Yeah.
The thing that's exciting to me is I've been treating feet for almost 20 years now, various different types of injuries. Before we had this laser, we've had it for a couple of years now, if someone had sprained their ankle and bruised and got a tear, or if they had a plantar plate tear or some other kind of acute injury, all we could do really is say this is going to take a certain amount of time to heal. We just have to wait for this healing process to happen. With this laser now, it's really still surprises me even after a couple of years. We can get people healing 2, sometimes even 3 times faster than they would if we did nothing at all.
Absolutely.
Yeah, and that's really rewarding for us, and our patients love it because instead of waiting, 4 or 6 weeks, they can actually get fast early tissue repair and pain relief as well because of that tissue repair.
Absolutely.
And get back to life, work, sport a lot quicker. So it's pretty fun to use.
It is.
Yeah.
It is very fun to use. Yeah.
Now, so you're talking about acute injuries, and then I think people who are watching will understand, okay, if I roll my ankle, I should call Podiatry because they've got these, this treatment. What about people with more long-term problems? What kind of problems do you think you've seen really useful with this treatment as well?
Yep. So things like inflammation of the bursa, so bursitis. At the moment I'm treating a patient who's got retrocalcaneal bursitis, which is behind the heel bone, and obviously it's going to be a very sensitive area, so using the laser on that is basically helping to reduce inflammation around that area as well, and helping with tissue repair as well. So that's another condition that I've been using the laser for. Another one's probably like chronic Achilles tendonitis, insertional Achilles tendonitis, especially on the back of the heel bone. It's a very sensitive area as well, so it's another great treatment to use that on as well.
And these are those long-term annoying problems. So a lot of people will come and they'll sit in the blue chair in our clinic and say, I've had this for 6 months, 12 months, I've tried cortisone, I've tried this, I've tried that, we've had orthotics, all this kind of stuff. They're the kind of problems that we love using it for as well. Yeah. That chronic pain situation, a tissue that's been chronically inflamed for a long time can kind of get stuck in that chronic state. And the cool thing with the laser, in conjunction with a few other therapies we sometimes use as well, but it's really great when you can see this problem that's been stuck for months or years start to improve after even over 2 or 3 weeks sometimes. Yeah. It's just great to see these injuries getting back into a healing state again.
Yeah, it is.
Yeah. The effect of the laser is very complex. Some of the ways it works we know really well, and some of them we don't really understand at all. Just to give you an idea of the actual treatment itself, it doesn't cause any pain, does it?
No.
No. Some people say they feel a little bit of a tingling, but it's not because of the heat, it's just because of the cellular effects of the laser. It definitely has an early pain relieving effect because of the way it affects the nerves and some of the metabolites and chemicals around pain signaling to the brain, but it's quite amazing there. I think that the tissue healing, it's because this laser and these wavelengths stimulate the tissues to heal so much faster. That's how we actually get a long-term tissue change. And look, if I hadn't, I know that when we were considering investing in this piece of equipment, the research has been there, but actually when you see it and start getting those results, it's excellent. It's just so, yeah, it's fantastic to be able to do it for people.
It's life-changing.
It really is,
Yeah,
isn't it?
it is. Yeah.
So now this treatment is something that we would consider for a lot of our patients, but to know for sure whether it's going to be helpful, best thing to do is to come and see us in clinic. So myself, Esther, and our other podiatrists are definitely here to help you. Our front desk team can help. So if you think maybe laser would be helpful, call up and just give a short description of what's wrong and what's going on. And if you want to ask whether laser would be helpful, our front desk team will put that in the notes so that we know that that's what you're looking for and interested in. Now, if it's appropriate, we'll do it. It might not be the best thing for you, but it's definitely something that we can talk about if you come to see us. Yeah. So I think that's probably long enough. Only 6 minutes now.
Yep.
So thank you for watching. I hope this has been helpful, and we'll talk again another day. Bye-bye.
See ya.